Dental implants. Definition. A dental implant is defined as a substance that is placed into the jaw to support a crown or fixed or removable denture. Dental implant. An artificial titanium fixture which is placed surgically into the jaw bone to substitute for a missing tooth and its roots. Indications. For completely edentulous patients with advanced residual ridge resorption. For partially edentulous arches where RPD may weaken the abutment teeth. In patients with maxillofacial deformities. For single tooth replacement where fixed partial dentures cannot be placed. Patients who are unable to wear RPD. Patients desire. Patients who have adequate bone for the placement of implants. CONTRAINDICATION. Presence of non-treated or unsuccessfully treated periodontal disease. Poor oral hygiene. Uncontrolled diabetes. Chronic steroid therapy. High-dose irradiation. Smoking and alcohol abuse. Advantages. Preservation of bone. Improved function. Aesthetics. Stability and support. Disadvantages. Cannot be used in medically compromised patients who cannot undergo surgery. Longer duration of treatment. Need of a lot of patients' cooperation. Very much expensive. Types of implants. A. Depending on the placement within the tissue. Epiosteel implants. These implants receive their primary bone support by resting on it. Example: subperiosteal implants. Transosteal implants. These implants penetrate both cortical plates and passes through the entire endosteal implants. This kind of implants extends into basal bone for support. It transect only one cortical plate. B. Depending on materials used. Metallic implants. T alloy, micro-enhanced pure T, plasma sprayed T, non-metallic implants. Ceramic, carbon, alumina, polymer, composite. C. Depending on design. Screw-shaped. Parts of implant. 1. Implant body. It is the component that is placed within the bone during first stage of surgery. Threaded, non-threaded. 2. Healing screw. During the healing phase this screw is normally placed in the superior surface of body. Function. Facilitates the suturing soft tissues. 3. Healing caps. Are dome-shaped screws placed over the sealing screw after the second stage of surgery and before insertion of prosthesis. 4. Abutments. Part of implant which resembles a prepared tooth and is inserted to be screwed into the implant body. 5. Impression posts. Ideal REQUIESETS. To achieve an osseointegrated dental implant with a high degree of predictability, the implant must be sterile, made of a highly biocompatible material, inserted with an atraumatic surgical technique that avoids overheating of the bone, placed with initial stability, not functionally loaded during the healing period. Accurate impressions provide a foundation for successful implant prosthodontics. Impression materials. Ideal requirements. Complete plasticity before cure. Fluidity to record fine detail. Ability to wet oral tissues. Dimensional accuracy. Dimensional stability. Complete elasticity after cure. Optimal stiffness. Classification of implant impression techniques. Fixture level. 1. Closed tray technique. 2. Open tray technique. Abutment level. The implant bone interface. The relationship between endosseous implants and the bone consists of two mechanisms. 1. Osseointegration. The phenomenon of osseointegration of titanium implants was discovered by the Swedish surgeon, Brånemark, in 1952. Functional ankylosis. Bone adherence, where new bone is laid down directly on the implant surface and the implant exhibits mechanical stability. 2. Fibrosseous integration. Soft tissue such as fibers and/or cells are interposed between the two surfaces. Implant surgery. 1. One-stage, single-stage surgery leaves the implant abutment connection exposed to the oral cavity via an integrated transmucosal element, or a removable healing abutment. This eliminates the need for a second surgery to expose the implant. 2. Two-stage, the implant is placed below the soft tissue and protected from occlusal function and other forces during osseointegration. Top of the implant is completely submerged under gingiva. Two-stage ENDOSSEOUS implant surgery. First stage surgical technique. 1. Flap design and incision. 2. Flap elevation. 3. Implant placement. 4. Closure of the flap. 5. Post-operative care. PERIIMPLANT. Complications. Perimplant disease. Any pathological changes of the perimplant tissue. Perimplant mucositis. Inflammatory changes confined to the soft tissues surrounding an implant. Perimplantitis. Progressive perimplant bone loss in conjunction with a soft tissue. Maintenance. Patients should be placed on close recall schedule. Maintenance visit every 3 months are advised as a minimums. This allow for monitoring of plaque level, soft tissue inflammation and changes in the level of bone.